So the method we're going to look at here is one of the ones Dr. Still talks about with respect to diarrhea. The first thing he does with this particular method is he says you'd stand them against the door jamb with their back there, and you'd squish their shoulders backwards, and that would clear a circulation in the upper thoracic region. Maybe you believe that, maybe you don't. The next thing he talks about is having somebody on a chair. So essentially the idea is you're looking at the patient being lower than the practitioner, so you get angle. The next thing he does is he talks about putting the patient's arms over the practitioner's shoulder. That doesn't necessarily need to happen. What you're looking at is using general shoulder girdle flexion to try to be able to lift. You want something to lift against. Also, you could talk about the pecs lifting the front of the body, the serratus lifting. You could talk about different things, different muscles. That's neither here nor there, but he's talking about angle, so you need to be above them. You need shoulder flexion. So if what we're gonna do, just really quickly, put your shoulders over my arms, or my shoulder, your arms over my shoulders. I can't talk. Now his chest, or sorry, his head is not in the best spot. And you can see that I'm kind of, if I'm not careful, I'll lift him right off, right? So I'm rolling him over his ischial tuberosities, which is not necessarily what I want to do. If I want to get thoracic extension, I need a still pelvis, moving vertebral column, generally speaking, preferably the thoracic region. That's hard to do. So that works, but then his head has to be on my sternum. That's not going to be comfortable for everybody. So there is a variation of this that some may have seen over time. Just go arm over arm, right? Lift your arms up, put your forehead on it. Right, now hopefully this doesn't mess up the mic. Now I can work the T-spine a little bit, right? I can generate side bending. This side's okay, this side is less okay, right? I can work through that region, but I'm going to roll him over his ischial tuberosities. Also, what I want you to do, sit as tall as you can, look at the ceiling, stick your chest out. That's thoracic extension. I didn't get that, right? So although the method may have had some value for Dr. Still, it's a method that has too many moving parts that are hard to control. I don't like the method very much, but it is one of the ones that we show for historical posterity.